Almost all hospitals in the state of Virginia have hospital social workers. So those social workers are hired by the hospital to help families, including you and your infant, to make sure that you have all the resources that you need while you're in the hospital and then once you leave the hospital. And then some hospitals also have child protection teams, which are comprised of pediatric healthcare workers who are asked to see those families in which the infant might have been exposed to medication or drugs during the pregnancy, either because you're in a treatment program or because at some time during the pregnancy you used medications or drugs that might affect the infant at some time. Not all hospitals have those teams, but those teams are comprised of people that also are hired by the hospital, not out in the community in agencies, and are there to make sure that you and your infant have everything you need when you go home to be successful and to be able to demonstrate normal growth and development and do well, because infants are super hard to take care of.
Local district CPS caseworkers or family services specialists provide referrals to services aimed to promote your child's well-being and development. Sometimes your case is transferred to a different caseworker a few days or a few weeks after your baby is born, so you may meet more than one caseworker. Your caseworker will also have meetings with you to link you to resources for your baby's well-being, such as providing you with a resource to early intervention services or infant-toddler connection services, a great free program that helps babies stay on track with their development to set them up for success later on for when they start school.
I'm the social worker for Women's Health. I work here in the clinic with the medical providers who take care of you throughout your pregnancy and postpartum. Your child welfare or CPS workers work separately from me and the medical providers taking care of you and your baby. While your CPS worker will know that you have a history of a substance use disorder, they won't know the details about your treatment or about the recovery program that you're in. If you want them to know more about your treatment program, you'll have to give permission to both your CPS worker and the treatment program for the treatment program to be able to share information with your CPS worker. No information about your treatment is shared with anyone outside of your recovery program unless you give permission for that to happen. So that includes signing paperwork. It's your decision if you want your CPS worker to know about the treatment you're receiving.